All right. Welcome to the Member for Day podcast. I am your host, Eric Sedrans, and today we have Dana Katz, the co chair of UCLA Health Operation Mend, with us. Dana, thanks for
Hi,
joining
Eric.
us.
Nice to see you. I'm so happy to be here. Thank you for having me.
Dana, before we get too far into this, do you want to just give an overview, introduce yourself and your connection to the organization?
I would love to do that. Thanks, Eric. So my name's Dana Katz. Back in 2007, my in-laws had this idea to start Operation Mend at UCLA as a place for service members who were severely injured in the line of duty to come and receive very specialized medical care for free. So that's how the program started, and over the years, the program evolved. So,
Yeah, so tell me. So we're gonna do a little new segment here, Dana,
okay.
just called Five and Five. And you sort of started to answer this question, but you kind of beat me to it. But my first question was like really the origin story of this. Like, you could use your platform and time to do anything. Why did you specifically choose to start this organization?
Well, when we wanted to start the organization, it was the height of the wars in Iraq and Afghanistan. And in the papers every day, we were seeing um, people blown up, our men and women serving in the armed forces, so horrifically disfigured that my in laws thought, well, we have all the specialty care at UCLA to offer to
Mm,
the military. Why wouldn't we leverage that and bring it into partnership with them to help really restore people's faces? And that's how the program started, because at first it was really for restoring the faces of our servicemen and women who had been really disfigured. And we have such great plastics and reconstruction at UCLA that the
mm,
military really didn't have. So that's how the partnership started. But
mm.
it was in the news every day on the front page of the paper, these IEDs and all these terrible things that were happening. So that's kind of what started us.
Is there a particular story or moment that inspired you to start this that you'd like to share? I'm sure there are incredible amounts of stories and moments, but one in particular that you want to share?
Well, one of the stories that is part of the origin story is that my in-laws were watching CNN and an interview Lou Dobbs was doing with a young Marine down at Brooke Army Medical in San Antonio, Texas, and he had been blown up by an IED, and he was saying to Lou, "Now that I'm back on my feet, they got to fix the beautiful part." And my mother-in-law gave my father-in-law a big elbow in the side and said, "Ronnie, do something about this. We got to do something about this." So that's like the real origin story, because we had already been down to San Antonio and seen some of the programs for wounded warriors down there. But that's the origin story, really. And it was in that moment, I think, that they realized we can do something about this, and they went for it. Brought UCLA and the military together to form this partnership, this unique partnership.
So you're obviously running a member for a day auction.
Yes.
It's an incredible list of courses. Can you just explain where these donations are going to go and how they're going to help the servicemen? Because I think it's more than just plastic surgery now, right?
Oh, we have evolved over the last 17 years. We have a huge program in mental health, intensive treatment programs for post traumatic stress and traumatic brain injury, um, in addition to our physical injury program. So the money that we raise in this auction is going to go directly to funding patient care, which
Mm,
means veteran service members and their caregivers. We're the only program in the country that treats caregivers as patients in our intensive treatment programs alongside their veterans. So we do something very unique, and every dollar raised will go straight to taking care of our service members, veterans, and their caregivers.
Why is the caregivers so unique across the spectrum? Why are you the only organization that's doing that?
It's such a good question. I wish more of them were doing it. There are a lot of programs that have focus on caregivers and how difficult it is to be a caregiver, and resiliency for caregivers and that kind of thing. But we're the only ones in the country who decided that they should come in as full patients into our program alongside their veterans. You don't have to come in with your caregiver, but you can come in with your caregiver in the intensive treatment program, and your caregiver and you really learn how to rebalance the family, the
Mm,
family's needs, and priorities and how to for a caregiver kind of take back control of yourself,
Yeah.
because caregiving is so difficult.
Yes, firsthand experience with that, so I can echo your sentiment for sure. What so our community members they're going to see your auction and going to be bidding a lot of money on some of these experiences.
Come
What
on.
message would you like to share to them of why they should be just a little maybe extra generous in their bidding?
Operation Mend saves people's lives and it improves their lives for the better in a way other programs just don't aren't able to do. And I would tell you that, um, because it's expensive. The program is expensive to run because it is intensive and it's very specialized. But our patients come out and our caregivers, and they are so much better than they were before, able to move forward, lead their lives in a way that they never thought they could before. So we're a place where many of our patients come as a last resort, after having tried a lot of other things. And
Mm.
once they get to us, I think they breathe such a sigh of relief that they're really heard and understood and that they feel hopeful.
That's amazing. My last question for you, Dana, is again, I know that the program has evolved a lot over the last 17 years. One of a big part of it is mental health and suicide reduction of service members.
Mhm.
Are you making progress in that? I know it's such a important issue for veterans, and I just wanted to just kind of hear of how that's going and if any progress is being made.
We are making a lot of progress. I think we've been incredibly innovative with the way our programs are structured, and our patients are leaving us with reduced symptoms and that they maintain. We follow our patients, so um, our patients after a year are still where they're still better. They're
Mm.
they're they're holding their progress, and that in itself is amazing. I mean, we have a 97% completion rate in our program for people coming in for care in the mental health side, which is huge, and we have beautiful outcomes, because we've been innovative. So I think we are making progress. There's no quick fix, pill to take yet, but there's a lot going on in the field, and we are there to evolve as our patients' needs evolve and to innovate wherever we can, and it's working.
Yeah. Dana, it's amazing. Your auction is also amazing. I'm going to just list out some courses. I know you're not necessarily a big golfer, but I am, and I can talk to a few of these. I mean, you have some incredible golf courses: Grove 23, Riviera, Farm Neck, Baltusrol, Apogee Club, Hillcrest. Really, some amazing courses. So,
Don't
you
forget the
know,
preserve.
and the Preserve.
Don't
You're
forget the
right.
preserve.
It
That's
wasn't on my list. I love the Preserve.
The preserve is a great one. We've got the preserve. I mean, I know Grove 23 is. Everybody's super excited about that one because it's so exclusive, but we got great courses. Thanks to all of our supporters all over the country. We are a national program. I didn't say that. Our patients come from all 50 states
Mm.
and territories, so we are a national program. So if you're willing to help us, just know you're helping people from all over the country receive free care, travel, accommodations. We take care of everything, for our patients to make sure that they can come and be better.
It's incredible. Dana, I thank you so much for your time. The last thing I want to know is just how can our listeners get involved with the organization beyond just participating in the auction? Can they follow on social? Can they reach out by via email? Just how can they stay involved?
Absolutely, they can stay involved. Please follow us on social. We do great social stuff. If you are an East Coaster and you want to join us at Veterans Day, we walk in the parade up Fifth Avenue on November 11th. If you are a
Mm.
West Coaster and you live near us in Los Angeles, you can volunteer as an Operation Mend buddy, which is a wonderful way to give back. And we'll match you with a patient who's coming in, and his or her caregiver, so you can support them while they're here. So there are lots of ways to be involved with us. But first, follow us on social, and you'll probably get a chance to see what we're up to.
Dana, you're an inspiration. Thank you so much for your time. And to everyone who's watching this, go in and bid. This is an
Bid,
amazing auction, an
bid,
amazing
bid.
organization.
Thank you, Eric.